Okay, so finally I'm back on the air talking with experts, talking with people who've been very successful in different walks of life. But with a little bit of a twist today, I am with the fantastic and wonderful Dr. slash Surgeon Siun. Very welcome and thank you for taking some time to chat with me today. As you can see, you're just after operating, or else you've set up this really cool podcast studio. Which is it?
It's all a fake. It's actually a
Oh,
screen, fake screens that you can use when you're on. Yeah, I finally copped on to how to do it.
a green screen. I love it. Well, look at I've a pop-up little studio here with lights and things hanging out of the ceiling. So let's hope a dog doesn't knock it all down. But listen, such is life, and this is the real world. So just to give a quick little intro as such, myself and Shun have been working together. I've been getting Shun out of bed early in the mornings to exercise and stretch a lot recently. Having worked with surgeons in the past, I've seen some of the pitfalls associated with the with that career, and with the positions that you get into. And I'm going to offend you a little bit here by saying, when I heard the phrase plastic surgeon, which is your title, I was like, plastic surgeon, I associate that with nip tuck and with facelifts and with all that. And as I got to understand a lot more about you and what you do, and obviously then that's backed up with some of the images you've sent me of some of the procedures that you've done and things like that in the past, I've been blown away by what your job is and what you do. And I feel like when I put it out there to some of my followers and friends on Instagram about talking to someone in your world, I was not surprised at the response I got. Lots of people are so intrigued by how the world is changing, obviously from a plastic surgery point of view. But for what I'm more interested in is how you can help transform people as part of their journey that they've undergone with myself or someone similar. So I'm going to give you a couple of seconds, June, where I'm not going to talk over you. That's probably the only time that's going to happen for the whole talk here. Where you can kind of just give me a quick synopsis of who you are and what you do.
Yeah, sure. Thanks, John. So I guess yeah, you're right. Plastic surgery. Even my dad, I remember years ago when I started. I mean, I'm in plastic surgery now for probably the guts of 15, 20 years. My dad was like, so why is it called plastic surgery? And it's actually from the Greek term plastare, which means to mold. So traditionally, and this goes back to like ancient Indian practices where plastic surgeons, a lot of the techniques that I still use now, and my colleagues will use, are like ancient Indian techniques of like nasal reconstruction to reconstruct when you take off a nose completely for a cancer. That there's an old technique of a forehead flap that we still use commonly. And it's like from AD 800 or something crazy. So the whole concept of molding a body and reforming or remaking its form back to as close as you can get to its excision or making a hole in it is what we do. So traditionally, plastic surgeons are reconstructive surgeons, and the whole kind of cosmetic part of that is just an arm of what, well, that's a bad analogy, a subsection of what we do.
Brilliant. I mean, the thing that fascinates me about all of this is how you can be so upbeat and so positive, yet the stories that you've told me about, like that, having to replace a nose, again, plastic surgery, I only thought of it from an aesthetic or a cosmetic point of view, and not from that whole piece about helping people who have undergone serious trauma, gone through a cancer, melanoma, or something similar like that. And it's it's an extremely amazing career, an amazing and rewarding job, no doubt. But can I just ask you one question now? As you've stemmed in, like, how do you go from general surgery to getting a bit more down the plastic surgery route? Was there, as part of that journey, was there a piece where you were like a heart surgeon, or do you just go specifically into plastic surgery?
Yeah, no, I wanted to be a surgeon since I was 3, and I was really sick in hospital, and I had a life-saving surgery. And have you frozen? No, did I freeze?
No.
You're okay. I had surgery when I was 3, and my mum says ever since then I wanted to be not just a doctor but a surgeon, and I've kind of been unblinkered all the way through that. So when I decided I wanted to do medicine, for sure it was always medicine. My CAO form had 4 medicines. I drove the career guidance counselor mad because all I had on my form was medicine, 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 and she said, "You having a sniff? You're going to have to put something else down." But I went through it then and I wanted to do pediatric surgery and then cardiac surgery. And I kind of dabbled in a little bit of training and seeing a little bit of both of those things. And then I did urology for a while as part of my general surgery training. So we do general surgery training first. It's a long career path. You do your intern year, Then we do basic surgical training where you do kind of 6-month blocks of different specialties within surgery. So general surgery, vascular surgery, urology. I loved urology, which is doing, you know, taking kidneys out, doing prostate gland circumcisions. I just found it really varied, and I love the people, I love the patients, and I love the surgeons. I thought they were all quite normal.
Right. Normal
and
people.
I was yeah. And I was scrubbed one day, finishing, I think, an old guy's surgery. And I said, you guys, like, to my registrars, I was like, you clear off enough coffee, I'll finish up this and make it look nice. And one of the guys said, he's not going to care. He cares about how he pees, not how he looks. I was like, you're wrong. And he's like, said to me afterwards, he was like, do you ever think about doing plastic surgery? And I actually hadn't really come across it as a specialty. But then I ended up doing my next rotation for 6 months in Crumlin, and I was sold. That was me.
Amazing. Well, I love hearing a backstory to it. And I have a podcast called Success Stories, and I love hearing about how people, like, from the age of 3, what inspires someone to achieve greatness and success. So as a I don't know, whatever little offset to this entire talk, that it's lovely to hear that piece to it as well. So I put the question out to everyone on Instagram about what sort of questions would you ask a plastic surgeon? And do you know what? One thing that I've noticed from all the questions coming back is that you guys are not very accessible, possibly, to general population. It's not like you can just ask a fitness coach, what should I eat, you know, for breakfast? Or it's like, so there's obviously a lot of fear. Most of the questions were around fear. You know, I'm very nervous about this, I'm very nervous about that, I'm nervous about the other. And because I feel like this could end up being a 2 or maybe 3 or maybe 5-part talk, I'm going to kind of cut straight to the chase with some of the questions that people did ask me about plastic surgery, about kind of cosmetic or aesthetic surgery. Is that the right way to word that? So a lot of the questions were around tummy tucks. And one of the first things that I want to ask, as well as everyone else, is what exactly is a tummy tuck? Because the phrase tuck, for some people, I think they think that you just kind of like cut a piece out and then tuck it all back in. But if you had like an elevator pitch as to what a tummy tuck is, what would that be?
So I guess there are 2 kind of elements to tummy tucks, and I would do quite a lot of mummy surgery, for want of a better term. So it kind of, you know, you asked me there about what is plastic surgery, and a lot of the reconstructive stuff that we do is reforming a hole from a nose, reforming an ear, but you're restoring form. And it's not dissimilar to a post-pregnancy body, which some people can have 5 babies and look perfect, and their abs are a little bit split, and they have a little bit of extra skin compared to their like 20-year-old self. And they look pretty untarnished, actually. And then some people can have 1 baby and have a massive gap in their muscles, and people are asking them, you know, how have they long left, you know, even though they're not pregnant. So it's very variable. That's very genetic as to how you're going to be affected by carrying a full-term pregnancy and have a delivery, and whether you were sectioned, etc. So a tummy tuck really restores the core muscles of, and it used to be the case, we used to bother with the muscle at all in old style tummy tucks. Now we restore the muscle, so we repair the muscle on the inside. And also, it's almost like the skin part is the kind of icing on the cake for a tummy tuck. I believe it's all about restoring your core, realigning your spine and everything, which is what you need to live for a long, uncrippled life. You need to have your back strong, and to do that you need a strong core. You know that better. So repairing the muscle is a massive part of a tummy tuck. Taking off that skin when you pull it down tight over the repaired muscle is an added little perk. Okay,
so the separation, I mean, I know a lot of guys who have separation, abdominal wall separation, and I mean, it is so impactful in how they move, back pain and problems down the road. So there's a cosmetic piece to it, I understand, from men and women. But there's also then, from a structural and a physiological point of view, it makes sense to try and regain that form. And the whole plasticity, I'm even thinking of neuroplasticity, of regaining or bringing something back, remolding it. It's very fascinating. And this is a question that one of a couple of questions that came in was, do you use mesh? So is this similar to a hernia procedure where there's a mesh piece if needed to help knit that abdominal wall back together? Okay.
Yeah.
And is that
good? Yeah, it's a valid question, because a lot of the tummy tucks that when I would have come up through training, we always involved a general surgeon in the surgery when there was that divercation or that split in the muscles. So now what I do is I come in, like say you've had a cesarean section, I come in underneath your cesarean section, lift up that skin and fat up to the level of your belly button. Your skin, can you see what I'm trying to demonstrate?
Yeah, no, we've got you.
Like lift up the skin off the belly button. So your belly button doesn't move. It's still stuck to you, coming out between your muscles. Just lift, undrape that skin from off the belly button. And then I tunnel right up to your rib cage, to your zippy sternum up here. Mm-hmm. And then I fully all of the core muscles. And it's not just about those two strap muscles, you know that too. It's about your versus your external obliques, your internal obliques. And they're all desynchronous. None of them work properly when you have a gap between the strap muscles at the front. Mm-hmm. The two strap muscles need to be side by side for your whole core to work in unison. And that gives you that whole spinal protection, because when your core is strong, you're protecting your back.
Sure. And capacity to brace.
Yeah. The other knock-on positive thing that women get after having a tummy tuck is when you have that split in your muscles, that being repaired, when I pull it tighter in the midline, I pull it tighter upwards as well. And that hitches and has a kind of hitching effect to your pelvic floor. Mm-hmm. So people often, and it's so common, have issues with stress incontinence. When I tighten that pelvic floor indirectly, they have a huge benefit in not having to, run to the bathroom when they smell the garden.
Exactly. So, and jumping on trampolines, etc. So the law of tensegrity is, if everything is intertwined and connected and one little piece comes out of shape, it knocks everything out. And this leads to a broader conversation that we would generally have around how nothing happens in isolation in the human body. And I don't want to get down that rabbit hole because I know we could go very far. So I'll bring it straight back to that again. And the whole pelvic floor piece and the connection. I mean, pelvic floor is a good buzzword at the moment that a lot more people are aware of and a lot more people are acting on, and in a kind of a prehab preventative way. Have you seen a change in, this is maybe a strange question, a hard one to assess, but do you think that the amount of work we are putting in my world, where we're talking to people about pelvic floor work, we're doing, Pilates and prenatal work, and we're doing all that, is it translating into better abdominal walls and less procedures, do you think? Or is it just a case that, like you said, there's a genetic factor to it and you can do all the squeezies in the world, but it doesn't help?
I think so. The pelvic floor and the core are actually, they're not dissimilar when you think about them. And what your role in educating people and helping them to make their muscles and everything stronger. If you have a gap in the muscles in the front, and it's the same, have like a kind of minuscule little pelvic floor muscles, they're not up to much. And when you bulk them up, they're going to be stronger, tighter, more tethered, and that's going to help to support your pelvic floor. The difference in the tummy is that when you get that split in the muscles, you're tearing across your linea alba. So that is attenuating. And I know we've talked together about fascia before, and fascia is like a kind of dense cling film. So when the muscle splits in pregnancy, and I remember the moment my tummy split in pregnancy, my phone fell out of my scrub pockets, they're badly designed for phones, into the toilet. And I leaned backwards to see, and I remember toning, and I thought, well, that's the moment where my muscles have gone past the point where, I'm going to see a difference. Now, I think what happens when you're sectioned, that gets bound by some scar tissue, and it's difficult for the muscles to come back and connect back together again. And when they they're frozen in time almost, and they're separated by that fascia, you can bulk up the muscle on either side, but you can't get the edges to come together. Yeah, because you're just buckling that fascia between the two. But the positive thing with keeping it strong, if you're going to need a tummy tuck, is that when I repair it back together again, you're much faster back into action if you've got strong muscles.
Yeah. And is that systemic? Do you see that as in, like for someone having knee surgery, you'll work on building up the quads, you working on the opposite leg, you work on upper body strength, because there's a systemic spillover to being stronger. And sometimes I've seen, so I have clients we have mutual clients who've gone to you, who've lost weight and want to remove some skin, etc. And they go in and they bounce back and they recover stronger. And any type of strength training, any type of fitness work, when they're coming from a low level like that, is going to improve their chance of, their rate of recovery. They're going to recover anyway, but increase reduce the kind of off time out of work, etc. and stuff like that. So you do see that, and that again, a lot of the questions that people were asking around tummy tucks specifically is, what is that period where you're, first of all, a lot of people are going, how long are you off work? And secondly, how long before you can start exercise again?
I just remembered I didn't actually answer that question about mesh. I don't use mesh. So what has happened now is the need to have a general surgeon to come in. They used to come in and place the mesh underneath the muscle to stop your bowel from herniating out through it. So it is like a hernia through that linea alba, that fascia.
Yeah.
That your bowel would kind of herniate forwards through that, and they would put a mesh in underneath, and we would do the tummy tuck over it. Now we repair the muscle in whatever vector it needs to be repaired, as well as the midline. I'll often repair the side muscles as well if they're looking at attenuation split. So I never use a mesh, and it's unusual to have a mesh repair now. But that's just time and progression of surgical techniques. With regard to how much time you need to get off work, well, so many women now, and it's the reason our lists are so busy as well, is that people are hybrid working. So I have many patients coming into me for a tummy tuck or breast surgery or whatever it is, and 2 days later nothing happened here.
Yeah. Okay.
And they have that flexibility, which has really changed. It depends on what you do in your life as a job. Special needs assistant who's manually handling, kids, nursing, stuff like that you're physically, very involved in your job. I would say at least 3 weeks until we see you back and check that you're okay. Same kind of applies to exercise. I say for a tummy tuck, you need 10 days of very much downtime. If you're not in a dressing gown, pretend you are. Nobody wears dressing gowns anymore. And then the second 10 days of kind of very low activity. Like you can get up in the morning, you can make the kids lunches. I don't want stacking dishwashers. I don't want 6 plates lifted to a high shelf. I don't want the dog walked. And then usually at the 3-week mark, if we're happy that the wounds are all healing really well, we will either start you on the M-Sculpt Neo that we have, which is like a passive exercise for your core muscles, where we control the activity level. And if people aren't doing that part, I'll give them a kind of program of gentle core exercises to begin, or defer back to you, etc.
And do you feel a Pilates, like after that 3 to 4 week period, like with a lot of surgeries, connective tissue should be getting a lot closer to healed? And do you feel like Pilates is an option in this case, or are you still you prefer to just direct with very small core-based stuff?
Definitely start some core exercise, provided they're in a controlled environment. I think what I don't want is people hopping out of bed and doing 50 sit-ups on their new tummy tuck with stitches that haven't even united. But bodies are amazing. Like you look at you cut your hand, and if you don't stitch your hand and you just wrapped it up tight overnight, it stops bleeding and it sticks back together. Like we're mad. We're like human bodies are amazing. Yeah, that fiber and glue that your body goes, we've got an insult here. We just stick it back together. Never mind my stitches. Bodies have an amazing regenerative capability, but you just need to listen to it as you're healing. And all your high protein and your vitamin C and zinc and all that stuff afterwards, that all really helps.
Yeah, collagen, vitamin C, zinc, and magnesium. But nothing good happens unless you're sleeping properly as well. Like that's the one thing I would say. And I know that's easy said when you're not, after a procedure, there's obviously the stress of the whole thing, the trauma of going through a procedure. So you're maybe not recovering the way, but I'm always encouraging people to focus on those pillars. It's a multi-pronged attack of getting on top of sleep, nutrition, hydration, your red light therapy, your M-Sculpt, your pieces like that. And I think from my understanding now, having spoken to you obviously over the last few months and stuff like that, I do feel like there's still a huge fear around all this, but I think it's something, I mean, what do you say to someone who walks into your clinic who has carried 40 kilos their whole life, they finally lost this weight, they've got this skin that they're now extremely embarrassed with, about, I mean, the thoughts to a lay person of cutting pieces of your body off and getting rid of it or something like that is extremely daunting. And yes, when I speak to people who've gone through it and gotten to the other side of it, they're, the weight of the world has been lifted off their shoulders. What do you say to people now? Because I think the biggest fear is a bit of a fear of the unknown, a bit of fear of maybe, I don't even think it's the pain or anything like that. It's like, what can go wrong? So if you're to say, is there something that can go wrong, or how do you put someone's mind at ease? And we probably then leave you alone, but to go back into your next procedure, or possibly you're going to drive a horse box. I don't know with you, but, and what would you say to someone that?
I think I see this a lot, right? So I about 50% of my practice is cancer and 50% is purely elective in tummy tucks, breast reductions, breast augmentations, lifts, etc. I think the massive problem, And the difference that I see is that there's much more fear in patients who have chosen to come in and have a procedure. It's a really weird space. And I say it to my patients all the time. I said, you've got to like me for a start. You have to feel like you have a rapport with me, because the bottom line is you'll be asleep and I'll have a scalpel. But it's true. And that's got to be as happy a space as you can make it. And I always say to people, if we're having a first consultation about your tummy tuck or your weight loss and your arm lift or whatever, if you leave the room and you're like, oh my God, that is terrifying, you're not ready. It's not the time. I'm not the person. It's not the place. For whatever reason, it's not syncing. If you leave the first consultation and you're like, oh God, and I'm not sure whether I feel fear or excitement, that's better. That's the place I want you to be. I think it's a control thing, John. I think when people have said they've come into the hospital and they have, and again, it's weird, like we are strangers essentially to our patients bar a couple of meetings, and you're coming in and you're saying, I'm perfectly well. Can you please give me drugs so that I'm completely out of control, and then take a scalpel and cut into me? Thank you. Like that's a weird space. I'm weird about getting on airplanes because somebody else is flying the airplane. I'm flying this airplane and I'll mind one person, but it's giving over that control. And I think if you have a AAA or an aneurysm and it's burst and you need emergency surgery, and I'm the only show in town and you think I'm a crazy kooky, you don't have a choice. It's all in it's out of your control. Whereas here they have absolute control over it, and that's a funny space to be in. And I think that's what brings the fear.
Yeah, so I get that.
Yeah,
I get that. And trust your gut. I mean, how accessible are you in that sense? Like, if people want to get in contact, can they literally just message your clinic and come in and have a chat about this?
Yeah, they just email is the easiest thing. I mean, I think we're all on email now, but it is a daunting space to be in, and I think it purely comes down to deciding you want to be medicalized when you're not sick. And traditionally, medicine is there to fix a problem. Yeah. But I think surgery has become so accessible, so safe, so regulated, so managed. You're in and out. I do most of the stuff that I do is day case surgery. You're in your home having dinner that evening thinking, I can't believe that just happened. All my breast surgery is day case now. When I was training even 10 years ago, you were in for 4 nights perhaps with drains, recovering. You might have needed a blood transfusion. That's a very changed landscape. They're out same day, couple of bandages, shower the next morning. They can drive the next day after breast surgery. That's a very different space. And anesthetic drugs are out of your system very quickly now. You feel very crisp and very awake very fast and alive. A lot of people are worried about the anesthetic.
Yeah, it is. I had my first one and it was a strange experience.
Yeah.
Siun, I'm not gonna keep you longer because I know, as I said, you're busy, but I do think there'll be a part 2 to this. I think that the most important pieces for me for this is that, like, the fear of what surgery, the whole concept of what surgery is, obviously it's scary and it's daunting. And we might close off this last little piece, but I'm not going to say has anyone ever turned around to you and said, I regretted that, but do you see when you meet your clients or your customers or your patients 4 weeks or that 3 to 4 week period, and they've gotten over the hump of that, what's the general consensus there? Is there emotions? Is there like, obviously people are delighted they've started this process, and just to sort of give someone who is on the fence or nervous or and very self-conscious and living in a state of all of this sort of stuff, to give them a little bit of an insight into what's on the other side of taking control and regaining pelvic floor health. I'm not saying it from a cosmetic point of view, but just regaining function, improving core control, improving core stability, improving, yes, the aesthetic piece to it. Have you a closing kind of line or comment that comes to mind when you think about all of that for someone who's new to that whole process?
I think with cosmetic surgery in particular, again, it's restoring your form and your function. It is such a happy space. People, even the following, I notice it even with people waking up, because you're so crisp after anesthetic now. There's not that hangovery, horrible, groggy thing. I mean, they're literally awake as I'm finishing the kind of, putting the bra on, putting the support pants on, and they'll wake up right beside me and there's no coughing and spluttering. They literally open their eyes and I'll say, you're all done. And generally it's a no. And then there are tears and and it's just it's a great environment to work in because people generally are so happy, and it changes people's breast reduction is an amazing procedure. It just changes the way their posture is, the way they hold themselves, the way they dress, the way their confidence increases. We've a lot of hugging in our clinic.
Love it. Love it. Well, listen, Siun, I'm not going to keep you any longer for today, but listen, I will link your email in and obviously your Instagram handle there so people can probably find a way of getting to you through that as well. I'll be seeing you later in the week for some training, but in the meantime, just a quick thank you. And we will definitely be chatting again soon.
Thanks, John.